An example of a triage approach for the shoulder. Imagine you have a pain in your shoulder. I often receive consults and find that the whole arm is painful, but that the pain was concentrated in the shoulder. Usually, the person cannot lift their arm. Now a warning, if medical terminology frustrates or scares you, just skip this. It's my job or the RFT's job to help you through this stuff. I include it to help you see a bit of the complexity we will wade through for you. First, a look at the physical. That shoulder pain can be coming from the shoulder joint, or a tendon, or ligament, or the cushioning sac, the bursa, or it may be a problem with the circulation, as the blood vessels that feed the arm may be pinched by tight muscles by the first rib, or the nerves coming from the neck may be compressed by bulging cervical discs. In such cases, we perform several specific tests to try to figure this out. These tests help pinpoint where the problem is. It also fits into a specific pattern, and by identifying this pattern, we can determine a possible cause and apply a possible treatment. That's the basic physical part. A registered functional therapist will then look beyond the issues of the shoulder and look at the functional tasks you are doing. Many shoulder injuries may recur after medical treatments like steroid injections or even surgeries. Symptom-reducing treatments often do not address the underlying issues, but instead simply remove the inflammation and pain temporarily. Sometimes a tear of a rotator cuff muscle really needs a surgical treatment. These people will need functional therapy after surgery to regain movement, use, and function. RFTs look at the cause and context. A shoulder injury for a baseball pitcher must be treated differently from a shoulder injury for an elderly person who had a fall. Their context and their abilities will be different. The young pitcher may have youth and hormones to help healing, and the elderly person may have wisdom and experience to help healing. The basic point is that the RFT will look at many areas. If a treatment is recommended that is not something they do, for instance, give steroid injections or perform surgery, then they could refer to someone who could. For the large majority of shoulder patients, a good first step would be to first find someone who can assess, analyze, and treat the shoulder condition in this holistic manner. Now, a new challenge, figure 5.5. A new challenge can send us back through the cycle, back to a survival, functional, or optimal solution. The arrow going from survival, functional, optimal is then met with another arrow that represents a new challenge that might send you back to functional or survival. In this case, our person with a shoulder injury may be well on their way toward optimal living in many areas, but the new challenge can set them back to a crisis mode where they must work again through survival, through functional, and back to optimal. Awareness of the temporary nature of a setback or a new challenge can help us to put these things into perspective. Find support and assistance from people who can help you through. Do what you need to do to get yourself back to a balanced function, and you will quickly return to that path to optimal health.